The miracle cure. A story on the not-so-miraculous cure. A miracle cure, or maybe we should call it a quick fix. A procedure that cured one problem but caused 10 others. The lobotomies are one of the most inhumane yet effective ways to change a person's personality in an instant. The history of them is one of the most twisted yet logical procedures, sometimes still used in psychology today. So, my main points are lobotomies are one of the most interesting techniques used by doctors because of their reason for using them. And after all these years of learning about the effects on what may come from lobotomies, we still use them, which is kind of interesting. In 1941, there were 48,216 people living in the UK. 1,000 people each year had lobotomies done. But if you divide 1,000 by the population in 1941, you would get a number 0.0207, which equates to 2.07% of the UK. Now, this percentage had lobotomies done one time, but it was most common that children and adults had it done about 3 or 4 times. Now, the first man to have invented these lobotomies, it was between Sir Wiley McKissick and a man named Egos Moniz. McKissick was from Britain, and he practiced most of his lobotomies at this hospital, Atkinson Morley's Hospital in Wimbledon. And one of his anesthesiologists, Terry Gold, had said that he was the best in the 20th century, the best lobotomist, which is quite a statement. There were multiple stations where they had lobotomies. This was one of them. There were a few in Dundee, some in North Wales and Bristol. It was kind of interesting because they had specialized hospitals for this, just for this. Now, the main reason for this technique was because the treatment of the patients was quite bad. Most of the time, people would be stuck in a cell with a straitjacket, and they would be left there for about 4 days with no food, no water, no bathroom, nothing. It was bad. And so these doctors came up with a procedure that they thought and hoped would free the people of a life of cruelty. Now you're probably wondering why and what a lobotomy is. Or you could be like Miss Alicia, who is wondering why I'm doing this project. A lobotomy, this is quite a long definition, but it is one sentence. A lobotomy is a surgical severance of nerve fibers connecting the frontal lobes to the thalamus that has been performed, especially formally, chiefly to treat mental illnesses. What a mouthful. And thanks Merriam-Webster for such a definition that needs defining. You're probably wondering what a thalamus is. It's the largest subdivision of the diencephalon that consists chiefly of an open mass of nuclei, blah blah blah. Now, that doesn't really matter because essentially it's just the gray matter in your head that has nerve fibers connected to them. These fibers were important because they controlled your emotions. So there were 2 types of lobotomies. One was the transorbital lobotomy, which was stuck up through your eye socket, like right under your eyelid, and they tapped it through, there's like a cavity right here that goes straight into your brain. It's kind of gross, I know. There was also the prefrontal lobotomy, which on the second picture, there is a hole, and there's a suture that goes around your head. It's called the cranium suture. And you would drill a hole right there, and then also shove an ice pick in there. But the weird thing was, they didn't have neurosurgeons. It was a surgeon directed by a neuropsychologist to tell you whether or not you were going the right way. I mean, what are we talking about? So this first picture is the transorbital lobotomy. They took an ice pick, shoved it up there, wiggled it around, and bam, you were good to go. So the first man to have reinvented these lobotomies was Igaz Moniz, but he had an associate. His name was Walter Freeman. Walter Freeman came up with the transorbital lobotomy. He actually adapted it from Igaz Moniz's original idea, and so I mean you can't really say that Walter Freeman decided it by himself because he got the idea from a psychologist in Italy who had already thought of the idea. Interesting fact about Igaz Moniz: he won the Nobel Prize for inventing the prefrontal lobotomy. The last man is James W. Watts, who was the anesthesiologist and assistant of Walter Freeman. They did many lobotomies over the 20 years that they were allowed to, until Walter Freeman made an oopsie and killed somebody. I mean, I'm sure he killed a bunch of other people, but this person was important. So for Walter Freeman's lobotomy, he actually would shock the patients until they were unconscious. Usually for adults and children, it was about 4 to 6 times for 40-second intervals. For elderly people, it was like 1 to 2 times. Lucky them. Rosemary Kennedy. I'm sure you haven't heard about her because she was kept in the shadows by the Kennedy family. She's the eldest sister of JFK, former president. That picture on the right is a picture of her after she had a lobotomy done. The reason was that she actually had seizures and she had violent mood swings, which caused her father to decide to have her lobotomized at the age of 23 in 1941. So the thing was, Walter Freeman did this, and this is one of his most famous failures. She was inert, which means unable to move, in case you didn't know that. I didn't, I had to look it up. And she was also unable to speak more than a few words. Essentially, she was a child in a grown woman's body. Now, this woman, Anne G. Krubsack, I could not find a single picture of her, which was kind of disappointing. It's history. In 1961, she had a lobotomy done by Walter Freeman. She actually had schizophrenia and was cured, miraculously. She had it done 1 time, and was cured. It was amazing. So Walter Freeman, of course, he made a big oopsie in 1967 with a woman named Helen Mortison. She died from a brain hemorrhage in 1967 after the 3rd lobotomy, which was really disappointing because then his career went bam, he was gone. So he retired in 1968, the year after traveling to talk to his former patients, one of which is trying to learn why his dad actually let him have a lobotomy. But anyway, Dr. Freeman died in 1972 from cancer, unfortunately. But you may be wondering, why does this actually apply? God. God is the main answer. God, he helped progress scientists when they were looking for medications, and it was only 54 years today since the last lobotomy was done, which is kind of interesting. We could have all been lobotomized by now if there was no science to help us. Anyway, that's it.